40 new cases were confirmed today. They included 4 in the community and none from workers' dormitories. The remaining 36 cases were imported and placed on stay-home notice when they arrived in Singapore. Now more details will be shared tonight. In its daily update last night, the Health Ministry said the number of cases in the community has increased to 14 in the past week from 6 the week before. Meanwhile, the number of unlinked cases has also gone up to 5 in the past week from 4 in the week before. A second local cluster has also been discovered. Now let's bring in infectious diseases physician Dr. Ling Li Min to discuss these developments. She's from the Rophi Clinic at Gleneagles Hospital. Dr. Ling, we're seeing an uptick in community cases and local clusters forming. And it's emerged that several patients in the clusters did not see a doctor despite experiencing acute respiratory symptoms. Is this a case of people letting their guard down or being complacent?
Yes, I think definitely this is possible. I have to say though, I think one of the patients had only complaint of dry throat. So when it's dry throat, it can be difficult sometimes to see a doctor for that. But really, I would still want to emphasize that you don't have to wait to be unwell or have fever to see a doctor. Given this current COVID era, we really should have antennas up, meaning that if there is that slight bit of runny nose or cough or myalgias or loss of sense of taste or smell, firstly, stay at home. If symptoms persist, secondly, please go and see a doctor.
Right. Now we've come a long way in keeping our local infection numbers low. So is the current situation a cause for concern for Singapore, Doctor?
Well, currently, given what we've seen the numbers since phase 3 reopening, not yet. However, we do have to remain cautious because, as you know, for the past year, we've adopted new norms. Some have been very painful, and Singapore as a whole has done really extremely well in the pandemic battle. And we need to continue on. So really, I would encourage everyone to persist, to continue on the good efforts, remember all the safe distancing measures, put on the mask, hand hygiene, stay at home if one is unwell, see a doctor if need be. Things that we have done so well in the past year, we have to keep doing it.
Looking ahead to the Chinese New Year festivities coming up next month, Doctor, what's your advice to Singaporeans who will be celebrating the holiday?
Well, Chinese New Year has always been, a timing for celebration and reunion as well. So certainly, I think this time we should be allowed to give ourselves a little bit of the chance to let our hair down. But being the COVID era, we do need to be careful. So a gentle reminder to everyone to continue those safe management measures at home. Keep an eye on the number of visitors that comes to the house or in any small group gatherings. Go slow down a little bit on the heaty foods and drinks because you never know, maybe eat too much fried food, we might get a bit of that dry throat a couple of days later. And then finally, again, if anyone feels under the weather or have a child with a bit of the sniffles, please stay at home. Do a Zoom call to the seniors if that needs to be done. And if symptoms persist, do see a doctor.
Now, Doctor, I just want to talk about something that the COVID-19 Multi-Ministry Task Force Co-Chair Lawrence Wong said on Monday. Now, he warned that additional measures may be necessary as community cases inch up here. What do you think could be some of the measures that will be tightened if and when the time comes?
Well, I think perhaps some of these measures may relate to better crowd management in public places, and as well as in our workplaces, perhaps segregation of certain groups of people according to their areas of work or even activities and responsibilities at work. Really, this is all to reduce intermingling in large groups of people. Another thing that we might see happen is an initiative perhaps to ways at looking at how we can look at improving compliance to existing safe management measures.